Welcome to the Physician Associate Podcast.
Hello and welcome to the Physician Associate Podcast. My name is James. In this episode, I was lucky enough to have a conversation with Matt Aiello, who works as a National Programmes Lead at Health Education England. HEE has made a huge contribution with driving forward the Physician Associate profession, and in particular setting up the Physician Associate Ambassador posts recently. Matt, thanks for joining me on the podcast. Do you want to start by telling us a bit about your work with Physician Associates so far?
Sure, yes. So thanks for having me. In about 2013-14, I started at HEE, and that was the point that Health Education England picked up Physician Associate programme. As the workforce pipeline through education and training stabilised, we've started looking at more innovative ways of supporting the workforce. So the ambassador model that you mentioned earlier is really a step in that direction to try and integrate PAs more into multi-professional teams across systems.
And one of the main things that led to the development of PA ambassadors was some initial hesitancy about physician associates in the workforce?
I'd say yes. We developed an approach very early on where essentially we take experienced PAs with us to these sessions and organise, kind of the equivalent of grand ward rounds or focus sessions with different parts of the workforce. So not just your kind of medical director, chief exec level, right the way through the system to workforce planners, workforce analysts, departmental leads, clinical leads from other professions. So you'd have your nursing, pharmacy, physio, paramedics from the ambulance services coming across to try and understand what this role is. And that was really important because it gave them an opportunity, I guess, to kind of poke and prod a real live PA, and ask questions and just have the opportunity to wrap their heads around what at the time was a very new thing. And establishing a brand new role in existing multi-professional teams was always going to come with a risk. But, we came into it with that understanding that this is something that we were going to have to sell. And I've always wondered whether that knowledge that student PAs have from day one, that they are by no means pushing an open door, and they really are needing to sell themselves to have the rest of the team trust them, as a means of integrating them into the multi-professional teams is really important.
So it was as people were beginning to meet PAs in real life and work with us, it started to become easier to sell the PA idea and make progress.
And that was the change that we saw starting to happen. It started to build that confidence in them that they were people that they would need, that could address an actual workforce need. And that was where we saw the change start to happen.
And I know some of your work has been in the urgent and emergency care side of things in the NHS, in particular getting PAs into primary care and GP surgeries.
That was something that was a great challenge to us at the time. And recognising in the 5-year forward view that PAs were a useful part of the workforce was helpful. But in the real world, it was putting PAs physically into those systems and thinking about how to, what support mechanisms could be put in place. So we launched a primary care preceptorship year, so a graduate preceptorship year for PAs going into primary care as a means of kind of softly introducing them to this very unique set of needs that would exist in those teams and giving the PA the tools that they needed to be successful in that role. And then similarly giving GPs as their supervisors, as their leads, that confidence again that PAs were getting the support they needed to become functional in primary care to be able to practice safely. So it was a journey for sure. And a PA will always be a PA, but then we can build growth into it. And one of the reasons that we started looking at the ambassador was, could that be, the first kind of vertical career development role for a PA, giving them that kind of strategic experience alongside their clinical experience so we can develop future leaders.
Okay, so can you tell us what a physician associate ambassador does in their role?
Yeah, it's probably useful to think of this in a literal term. So, an ambassador is somebody that is acting in that way for their profession, somebody who's in place to look at how to integrate their workforce.
Thanks for explaining the role a little more there. That's great. So you started with a trial of PA ambassadors initially, right?
I was working for the West Midlands team back in 2016. And we'd identified a need where we'd seen, PAs growing as a profession. We'd still seen a bit of kind of professional distance between them and other members of the multi-professional team, but also a distance between PAs and the system itself. So at a commissioning level. So, at your kind of CCG level, your then STP level, as it was evolving into integrated care systems. And what we wanted to try and do was ensure that in forward workforce planning and forward commissioning models, the PAs got a look in, that at that kind of workforce planning level, they were actually understood in terms of where they were, what they did, what their potential is. and where they sit as part of a multi-professional team across sectors. So our concern was, and still is, that the system is moving very, very fast. We're seeing an evolution of the NHS, I would argue, at a scale that we've never seen before. And the risk for that is that if a staff group or a clinical profession isn't fully understood, then the risk is that it falls between the cracks. It gets left out of forward planning. So at the time, the rationale was, could we develop something, a strategy, that essentially gave PAs a seat at the table, that gave them the opportunity to speak for their profession, explain themselves, and make sure that they were included in this evolution that we were seeing. And ultimately to try and integrate PAs as part of multi-professional teams across sectors going forward. So we trialled an approach that we'd call the PA Ambassador at the time. And this was with 3 or 4 people in the West Midlands, all experienced PAs. What we'd wanted to do was get PAs from different sectors so we could see as a cross-section. We didn't focus on any one sector. We wanted to demonstrate if you had a unit of individuals working, one in primary care, one in the ED, one in the AMU, one in mental health, how they could cross-fertilize their knowledge of these different systems and come together as a unit to drive system-wide change. So it was very much a pilot at the time. No one had ever done it before for PAs, to my knowledge, for any other profession. And we'd invested in it at HE at a regional level and really kind of just tried it first to see what it would do. And effectively, we took a half-time equivalent of one PA role. So for half of their full-time job, they were working with us. For the other half of their full-time job, they were remaining in clinical practice to maintain their clinical competence. And we were working very closely with their employers. We wanted their employer to be in this, to understand it, and to work with us to develop it. Because what we didn't want was for this to be something that would look like us doing to the system. We wanted the system to feel a sense of ownership over it. It was really important. So we took that forward. And we had the PAs working at a number of different levels strategically. So we had them working at an employer level within their own organisation to think about how PAs are represented. So if you had a PA in an acute trust that was coming in to be an ambassador, it was thinking about departmentally and trust-wide, how PAs are seen, how they're identified, and their development pathway. From there, they were working at a local level, so system level. If their employer was part of an STP or part of a primary care network emergent, or what at the time was a community education provider network, and now ICS training hubs, how they were working in those systems to try and bring the PA profession to the fore and have system planners start to understand what this role actually is, what it does, and where it fits in the wider workforce. And then working with us at HE, you'll know now that we're split into 7 HE regions aligned to NHS England's regions. So thinking about how PAs are being brought into strategic conversations between the key arm's length bodies, NHS England, the Department of Health, HE, Public Health England, and trying to think about how they're creating that voice for themselves at a strategic level. And then nationally, you'll be aware that PAs don't currently have a national community of practice. So we were thinking, if this was something that was going to expand to a national level, what does the profession need at that level?
And from the trial area and the pilot scheme, it's now expanded across the whole of England, right?
So the pilot ran from 2016 to 2017, very quickly started to see benefits at local level. And at that point, we started to think, this is generating enough evidence and enough interest from employers. We had employers coming to us, which is always a great litmus test for it being successful. We had, for example, a couple of PAs working in the North Midlands and the Staffordshire area that actually developed the UK's first graduate preceptorship year for PAs in primary care in a GP federation in Stafford. And this went from having a very underdoctored, very undersupported region to having a unit of PAs developing. So it went from a kind of a zero number of PAs in that region to double figures of PAs in that region. And those PAs were coming in because they'd identified that having that graduate preceptorship year was something they wanted to do and felt the need to do. So these ambassadors helped kind of pave the way for this as a way of attracting and then retaining PAs in an underdoctored area, which had quite significant benefits. And the team there are about to publish on that work. When I moved into the national team in 2017 to 18, I made a pitch for this as a national program, and it was taken up almost immediately. And we recruited PAs across what then became the 7 regions. And what I wanted to do was see an even split of PAs across these regions, and then starting to develop a kind of national picture around this. So just quickly checking my notes. We started off by offering 49 PA ambassador posts across the 7 regions. Taking split posts and that into account, we have ended up in this year now with 68 PA ambassadors, which was just amazing, and we've seen this survive through what would be peak demand periods. So I guess you and colleagues who work in the sector will know that as soon as peak periods like winter pressures hit, the usual reaction is to pull off education provision and move people into frontline activity, or divert people away from the more transformational work back into clinical work, which is absolutely right and proper. What we've seen with this is employers actually protecting this role. When the COVID pandemic hit, we'd offered all employers the opportunity to suspend this and pull back. Obviously, the need was on the front line at that point. And the vast majority of the employers in this setting really wanted to keep them doing what they were doing because they were seeing a benefit in the ambassador role as a role that can actually facilitate, the movement of workforce to areas of need. And they found that very, very useful. So we've seen a constant continuing demand for this role. We've seen some of the areas, some of our London colleagues indeed came back about a year ago saying that the job description for the PA ambassador really closely aligned with what the primary care networks were thinking in terms of developing a clinical lead role for PAs. So one of those early hopes that we had for this was that it would become a vertical career pathway, or the beginnings of one in England. And, we've seen evidence that that's starting to happen now, which is fantastic. So I guess in summary, it's something that grew from very small beginnings, but, it has grown proportionate to what workforce demand is telling us that they need. So the PA ambassadors as a unit have been able to move and flex with the times, supporting the evolving NHS as it's meeting these very unusual demands that we have at the moment. So we're pretty confident that it's being seen as a recruitment and retention strategy across systems. And indeed, it's been successful enough that we've actually modeled this for other professions. So we've just literally launched a paramedic ambassador role, which is very similar in its approach. And this is a really important part of this program. We didn't want to just kind of give them the role and then throw them to it. HE is quite well connected in that way. We've got voices at all of these key tables strategically. And what I wanted to see was HE really kind of putting our money where our mouths were, I guess, and saying, if you take on this role, we will support your development strategically. So we'll help you with these conversations. We'll help introduce you to these different systems. We'll give you very practical skills as well. So, we've done masterclasses for PAs in the past around how to write a business case, how to write an evaluation methodology, how to commission a service, how to launch an action learning set, how to develop a project, a service improvement project, or quality improvement methodology. All of the things that as a future leader working in a transformational space will be incredibly helpful to them.
From what you're saying, are there only PA ambassadors in England, or are there equivalent roles across the rest of the UK too, Scotland, Wales and Northern Ireland?
Not that I'm aware of. We're always happy to share. We've shared with colleagues across the four nations many times in the past. We've worked very closely with Wales, with Scotland, with Ireland around the development of the PA role in general. But for me, it is one NHS across the UK. So any sharing that we can do, we are always happy to do.
And for any physician associates or student PAs out there now who are listening to this, thinking it sounds like a great opportunity, or that they'd like to speak to their local PA ambassador to find out more, where should they go to find their local PA ambassador?
We've got offices in each of the local areas, and each of those offices has a lead assigned to supporting PA ambassadors. So I would say for your student or your PA that was interested in this or wanted to talk to their local ambassador, to contact their HE local office. I'm happy to provide details for those contacts.
And I read a recent interim report into the PA ambassador role, which was evaluating the effect of the PAA. I was wondering if you foresee the PA ambassador role continuing long term.
That's a great question. So one of the reasons that we took the evaluation was to demonstrate the benefit of the role, to be able to make a good case for continuing the role year on year. It's absolutely right and proper that we should have to do that. We're spending public money. We need to justify that spend. We've put a case in for physician associate ambassadors for this next financial year. But, all of the evidence is suggesting that this is a valuable intervention, which is working. So, it will be for our decision makers to determine that. But I hope so. The profession deserves that level of support.
And in the near future, we're soon going to be GMC regulated. How do you think that's going to impact on the PA profession?
It's interesting. When we first took on the PA profession back in 2013 and started supporting That was a distant ambition, but one that we've worked towards from the get-go. PAs offer an invaluable service now, as an unregulated profession. But what we'd always held was that as a regulated profession, and with the benefits that came with, the value perceived of the PA and its potential to grow as a profession increase exponentially. Things like prescribing spring immediately to mind. It's something that we've worked with all of our system partners to try and achieve for several years now. So I would hope that with regulation, that the profession would become that much more in demand. The argument that we always made to system partners back in the day was, they're not regulated now, so get while the getting's good, because when they are regulated, we can imagine uptake increasing exponentially. So trying to get the system to grow its own PA workforce almost now is really an anticipation of that. So I would see a benefit, to be sure, but it's not taking away from the fact that they have a very significant benefit as it is.
And finally, is there anything else on the horizon for physician associates as you see it?
We started looking at the military application for PAs. They were born in the US as a means for veterans to transition into civilian healthcare roles. So we'd worked with our colleagues across the tri-services over the last couple of years to look at the facility for veteran medics to move into PA training or PA roles. It's an ongoing conversation. It's going to take quite a bit of work, but it was an interesting angle. It's just an interesting space to be. It always has. For me, it's been a privilege to see the profession grow from such a small number into what it is now. It's been a rapid rise for the profession, and I think my sort of takeaway would be that the profession as a whole and individually should be really proud of themselves for what they've achieved. It takes an awful lot to integrate yourself into any system at any time, but we've seen PAs do it again and again. They're a proactive bunch and sell themselves exceptionally well.
Thanks so much for talking to me today, Matt. I found it really useful to learn more about the Physician Associate Ambassadors and how they've evolved to help expand the PA profession. I'm really glad HEE are helping support physician associates this way. If you'd like to talk to your local PA ambassador, you can reach out to your HEE regional office, who will be able to put you in touch. Thanks so much for listening. If you'd like to follow the PA podcast on social media, we're at PA Podcast UK on Twitter and Facebook. I'm on Twitter too, at James Catton. Thanks again, and I hope to speak to you soon for the next episode.
Thanks for listening to the Physician Associate Podcast.